From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Thank you for joining us on this special edition of The Voices on Inside the 1581. And I'm Rich Rasmussen, CEO and President of the Oklahoma Hospital Association. And today we're broadcasting from the Convention Center in Oklahoma City as part of our OHA Connect conference. Now, OHA Connect is our annual meeting, and we kind of have a vision here at OHA to be more than just simply a hospital association. We want to be an active voice and really a field leader in the space of healthcare. So we don't call ourselves a annual meeting, we call ourselves a Connect conference. And so we're here this week with a number of speakers that are designed to really get us thinking about where we want to go in improving health and healthcare and how we can shape the work that we do in our organizations, that our team members do, our caregivers do. And part of that change really does start with effective leadership in the hospital. And I'm delighted to have joining me today Trent Bourland, who is the CEO of, make sure I get it right, Trent, it's Cole County Community Hospital? General Hospital. Okay. And I have been there.
You have?
I have. It's actually, I love visiting small towns, having grown up in a small town myself. And so what we're trying to do with this Voices segment is just invite several of our CEOs in, and we may have a passerby that's another clinical leader, just to come in and talk about some basic questions about the state of healthcare. And so before we get into that, Trent, tell us a little bit about yourself. I know some about you, but certainly our listeners may not. And I just want to remind you that Inside the 1581 is really designed to be a way for OHA to tell stories. And those stories don't necessarily have to be healthcare centric. And I think you've got a great story in your life in terms of how when you left and you had a passion to come back and serve your community. So maybe we can start with that.
Definitely. So my mother moved to Colgate when I was a young kid and actually went to work in the hospital in the business office. So I've had a strong connection with Cole County and the hospital there. After high school, I spent 10 years in the United States Air Force. I got out after I finished my commitment and worked for Oklahoma State Department of Health in a couple different roles. And then I moved to Oklahoma Department of Corrections and worked in managing clinic in MacAufford Correctional Center in Stringtown. And have some conversations with a board member on the hospital, and he said, "Hey, would you like to come work with us?" And it was just really an eye-opening experience to see the other side of it and the administrative role of the hospital, and then the challenges that small hospitals like us face. And so became the chief operating officer in about a little under 2 years. The predecessor moved on, and I slipped into the role, and it's been a fun experience and really just, as you pointed, really helped to ignite that passion for me in rural healthcare and trying to help others understand the challenges we face and put us in a better light and give us better options to provide to our communities.
And you know, it's not often that you have somebody that leaves and has every opportunity after they leave their community to come back.
Yeah, that is probably the greatest thing that I could do is I make an impact in my community, a community that I've been part of for the largest majority of my life, and be able to make those impacts and help people that I know and people that my family's done business with. My grandfather owned a tire and lube station in the community when I was a kid, so I got to go.
I love how you call it lube station, because I grew up calling it a lube station too, right? Now, who lubricates, especially with electric vehicles today, right?
Right.
You know? Yeah.
And so seeing that as a kid, and now some of those same people that traded with my grandfather are receiving care for us. And so the full circle there is inspiring, and it's hard to not see that and not be inspired to provide the greatest care possible to those people. So,
and for our listeners, if you're not in the hospital field, Trent leads a critical access hospital. And these are hospitals that have been defined by the federal government as our most vulnerable hospitals. And so there's a lot of effort taking place to protect these hospitals and to create an environment in which they operate in that hopefully will allow them to be sustainable. And so, Trent, before we get into kind of the question of how do we see the current system of healthcare in Oklahoma, maybe you can chat a little bit about the economic impact your hospital has. I'd be willing to bet you're probably one of the largest employers if we take out some of our tribal interests in your region. But, for your hospital, you're probably it.
Yeah, so we are the largest employer now. In that south central region of Oklahoma, we were once a manufacturer for Wrangler jeans.
Okay.
And through NAFTA.
I wore Wranglers.
Well, I do not anymore because NAFTA sent them overseas.
Well, that's why I wear Levi's now too. I think as you get age, your bottom end changes a little bit. Maybe the Levi's fit me better than the Wranglers used to.
Yeah. So they left in 2000 and. Between 2002 2005, they left, and a lot of those smaller communities down there have been. I think we lost 200 jobs, and
wow.
So now we remain as the largest employer, which also took away larger health plan options for people, and so we employ through our critical access hospital. We have a strong affiliation with our long-term care community and 3 rural health clinics. I think we have 164 FTEs, and so largest economic driver in our community. A lot of great jobs for people who may not have options to go be doctors. We can be nurses, we can be respiratory therapists, we can be radiology techs, we can be physical therapy assistants and lab.
And I think that's important, for policymakers to really recognize and appreciate what healthcare does to improve the economic environment in all of our communities. And we heard today, it was refreshed today from Paul Keckley, that in Oklahoma, those that work for hospitals are compensated about 27% higher than those that don't because of the high level of specialization and training our employees have. And so all of that is spent in the community.
Yes, and we are the ones who support the health of the farmers, of the ranchers.
Sure.
This is where your crops are grown. This is where your beef's grown. And without that, it has to go somewhere else. And they have to go somewhere else to receive the care. And that puts, their ranch or their farm at a greater loss because they're not there to produce. And so keeping that there, keeping an economic impact for it, and it's a wonderful thing for us. And if we lose it, now our small communities are even a greater disadvantage than we are today.
Well, and that's something for us to always keep in the forefront. And to me, as I've said to many of my colleagues across the state, that I feel like we've kind of turned a page. I don't want to use that word. Let's not use that word. Let's we have really leaned into our future. And so if I look at where we are today, we've modernized our Medicaid system. We have ensured that all of our hospitals, particularly our critical access hospitals, are not disenfranchised in moving into managed Medicaid. We've covered more people than we've ever covered before. We're moving in the direction of innovating in our state. We're focusing in now on primary care as an important part of how we deliver care. And so to me, the future is really bright. And I would be curious from your point of view, from where you sit in our state, what is your view? How do you see healthcare in terms of its current environment in our state? How do you read it? How does your community read it?
I'm optimistic about our potential. I mean, we have an opportunity now with digital communications to collaborate with larger health systems and then be advocates with legislators and community leaders to overcome any challenges and ensure that we remain sustained in our communities and our commitment and in the innovation side to get into telemedicine, to get into...
And telestroke is something you're trying to lead the voice on.
Yes, telestroke I think is significantly important. I believe the number is 73% of strokes are unnecessarily transferred to a higher level of care, and so working with our larger systems in Oklahoma, our larger anchor systems, to provide a stroke or a telestroke option for us, and keep those people in our hospitals, keep them under observation status, and if they need to go up, they can, but not transferring every single one of them out and putting a strain on those ours larger systems that are already taking care of their communities and other communities in Oklahoma. And then we can transfer them to swing bed and keep them in their community for post therapy. So it is a passion. I saw a community member pass away from a stroke, and it was untimely, didn't need to happen, and so it's really just ignited for me to try and take care of that.
Well, and clearly we know that when you can receive care at home, you recover better.
Yes.
You have the support system in place, and whenever we can do that, and I think that's been a big focus for OHA and our members, is how do we ensure that we have access, and that access means as close to the home as possible.
And lightens the strain on the families to be able to be there with them. They don't have to go to a metro, Oklahoma City or Tulsa, to be with them while they're receiving post treatment, and they can stay at home and help with the outcomes. Of research has shown that if your family's there, you're going to recover better, and so we can do that with these community hospitals. 39 communities benefit from a critical access today, and those are 39 significant economic drivers.
Oh, absolutely. And so this is your time to tell us about something you're particularly proud of in your organization, something that you guys have found success, and if you see other things that you believe or have been successful in the state, but certainly, Trent, for your organization, there's got to be some things that you're really excited about that you guys have accomplished. What would be some examples of that?
We've really leaned into the swing bed program.
Okay.
Research shows that we put those back into the community, those post-acute.
And for those that may not understand swing bed, explain that, because that is really the lifeblood of many of our critical access hospitals.
So the swing bed program is a skilled nursing unit in a critical access hospital. And so if somebody has a post-hospitalization and they need some type of therapy, whether it be IV therapy or physical therapy, occupational therapy, speech therapy, and so we can provide that in the critical access setting instead of going to a long-term care community where a lot of times they get in there and they aren't able to advance. Nothing against the long-term care, but we can keep them in the hospital and then get them back to the community, get them back to being benefit and not a long-term user of long-term care, which provides a great benefit. And so that helps us. It is a great economic impact for us. And so I believe the average benchmark for critical access swing bed is 14 days. And so that's 14 days of therapy that we can provide right there in their hometown. And
the number for being in a nursing home is how long? So you're on to something that's really important, because it might cost a little bit more to have a patient in a swing bed where they have the full complement of recovery services, but their lengths of stay are much shorter than someone who goes into a nursing home where the length of stay is longer. It might be cheaper per day, but they're in much longer, they're farther away from their family members, and the opportunity for that condition to erode because they may not be getting the same level of rehab and other therapies is real, because we see it in the data.
Definitely. It is an option, and it's not promoted as much. A lot of larger systems don't understand that critical access provide that. And so,
we need to make sure the larger systems understand that if a patient needs to go to a higher level of acuity and they're coming from your swing bed, it's a bed transfer and it's not a payment penalty coming from a nursing home.
Correct, yes.
Yeah.
And can help them with to drop their ADC. Another thing that we're doing is we received a USDA distance and learning telemedicine grant. And so that was, I think, $655,000. And so what we're going to do is we're going to put a telemedicine device at each hospital bed, tie that into the pillow speaker, and so we can provide specialty consults to our patient population. We're going to also put a cart in our long-term care facility to provide better options for visits there. We're going to put those in each one of our rural health clinics. and just try to get an option for our people not to have to drive. Colgate is 2 hours. I say it's 2 hours from everything, which I like. 2 hours Oklahoma City, 2 hours Tulsa, 2 hours Dallas, 2 hours of Fort Smith. But that's 2 hours of added burden on families to be able to visit and with their loved ones. So that is an option to significantly improve access to care for our community and enhance continuity of care.
So you guys have done some great things, and certainly you have been a real, effective voice for our rural communities and for our critical access hospitals. And I hear and see your enthusiasm, but I'm sure there are some concerns that you might have in terms of what might be the biggest challenges that the hospital field, or for that matter, the entire healthcare field, in the near and distant future. Do you have some thoughts on that?
Yeah, I mean, I think as a state, workforce challenges, workforce shortages,
Sure.
Physicians, support staff. But in the rural areas, we may only have 1 or 2 openings. But if you look at that on the quantitative data, then that's on the same scale as what our larger systems are facing. And so then we also, because of that, we have challenges in addressing health equities and access to basic services with prenatal care, mental health support, and missing those, then the poor outcomes are just continue, and we don't do anything to reduce that. And so it puts just a challenge on us, and we don't have access to the technologies that larger systems will. And I don't know, Rich, it's just we face the same challenges that these bigger ones do, but we don't share our voice. And something we've talked about on OHA board is the community benefit and getting out and telling the story of what our hospital can do, and then also the challenges that we face.
Well, and certainly, I mean, sharing with the public the great work that all of our members are doing in our smaller communities, how they are really transformative in these small communities. And certainly the work that you're doing in Cole County is an example of that. And telling our stories is why we do Inside the 1581.
Definitely.
So Trent, we're going to have a couple more of our leaders rotate through, but I just want to thank you for stopping in. I encourage you as well in your community to continue to do the great work you're doing, and invite them to listen in on your episode of Inside the 1581.
Definitely be sharing this with a few folks. But so happy to be part of it. So happy to have an impact, and I really thank you for the impact you're making in Oklahoma.
Oh, it's a privilege. It's a joy.
Yes,
it truly is. All right.
Rich.
Well, we're going to come back in a few minutes here. We're going to have a couple other of our hospital leaders joining us. I believe Bennett Geister, who is the Mercy Ministry leader, will be here, as well as Denise Weber, who is the CEO at Stillwater Medical Center, all joining us. And we might pick up a couple other folks as they are enjoying the Connect conference, as we continue our conversation and the voices of Inside the 1581.